Yeah, that's right, Jen. All of these state leaders telling me the same thing, and that is, while we can't necessarily draw a straight line between the COVID-19 pandemic and opioid abuse, we do know that isolation and economic hardship do play a role in the rising tide of addiction, and that is what we are seeing here across the state of Connecticut. State leaders gathered outside Connecticut's Capitol Wednesday to shine a spotlight on the state's opioid crisis.
This is a 13-year-old child who is dead after an exposure to a deadly poison.
That 13-year-old, a student at Hartford Sport and Medical Science Academy, that poisoned fentanyl.
We'll never be able to stop the supply of this stuff coming in from China, coming in from India, mass produced at no cost, finding our way into the street, unless we stop the demand.
Rodney Alexander, a counselor at the Root Center for Advanced Recovery, told Fox 61 that in order to stop the demand, we need to invest in more long-term addiction treatment centers.
When we deinstitutionalize the state hospitals, things have never been the same since, because you could go long-term. We need more long-term facilities in the state.
The fentanyl that killed this 13-year-old 50 times more potent than usual.
The supply is rampant out there, and it's dangerous, and it's a poison.
Nobody knows that better than the scientists of the State Controlled Substances Lab in Meriden. It's where law enforcement sends drug samples to be analyzed.
About 5 years ago, it was heroin and marijuana were the most prevalent things seen in our laboratory. Now we're seeing the fentanyl is topping the charts.
We're told that fentanyl is now responsible for about 85% of all the opioid deaths in Connecticut, 1,350 deaths last year. This year, on pace for more than 1,500. Governor Lamont with a stern warning to those manufacturing and peddling poison.
You're an accessory to manslaughter. Like Sal said, you're an accessory to a murder, and you should be held accountable when you do this to our kids.
Strong words from the governor there, and state lawmakers say that they will also be introducing legislation which they think may help curb the opioid epidemic in the state. Governor Lamont was asked if he supports a mandate that would bring life-saving opioid overdose drug Narcan within the schools and the nurses' offices. He stopped short of fully favoring that, saying that he first needs to talk to his public health leaders. We're live here outside the state capitol in Hartford. Matt Caron, Fox 61 News.
All right, Matt, thanks.